Hi, I'm Dr. Hadeli Salazar. I'm a pediatrician with HealthLink, and today I'm here to discuss some things you should know about keeping your baby safe during sleep. Did you know that placing a baby on their back to sleep reduces the risk of sudden infant death syndrome by as much as 50%? To avoid the risk of SIDS, use the ABC of safe sleep. Apart, because sleeping, whether it be with parents or caregivers on a sofa or recliner or in bed, it could dramatically increase the risk of infant sleep-related death. Place your baby in a safety crib, bassinet, or pack and play close to your bed. Sharing the room actually decreases the risk of SIDS by 50%, but not bed sharing. So the risk of a sleep-related infant death can go more than 10 times higher if a baby is sleeping in the same bed or in the same recliner with a parent, if the parent is fatigued, or if the parent is under any medications or have consumed drugs or alcohol. The risk of infant death can increase as high as 10 times more in babies younger than 4 months old, and also is duplicated when babies are born preterm or they are low birth weight. Back. Babies should be put to sleep on their backs. Babies who sleep on their backs are much less likely to die suddenly and unexpectedly than babies who sleep on their stomach or the sides. The problem with the side position is that your baby can roll more easily onto their stomachs. Some parents worry that babies will choke when they are on their back, but your baby's airway anatomy and their gag reflex will prevent this from happening. The crib. Babies should always sleep in a crib or bassinet that meets safety standards of the Consumer Product Safety Commission. The mattress should be firm and covered with a snugly fitted sheet. If a baby falls asleep in a car seat or bouncy chair, it's super important to put him back on a crib as soon as possible. Finally, check the CPSC website to make sure that the crib hasn't been recalled. Did you know that breastfeeding is associated with reduced risk of SIDS? And exclusively breastfeeding for at least 2 months can cut the risk of SIDS in half? The American Academy of Pediatrics recommends that mothers exclusively breastfeed or feed express milk for the first 6 months of baby's life. Breastfeeding can reduce the risk of SIDS by up to 60%. The longer the baby is exclusively breastfed, the lower the risk of SIDS. Breastfeeding also has many other benefits for both baby and mom. And these benefits include a lower risk of lower respiratory tract infections, diarrhea, asthma, eczema, Crohn's disease, ulcerative colitis, obesity, diabetes type 1 and 2, leukemia, and tooth decay. Also is associated with higher IQ scores in your babies, faster recovery from childbirth for you, low risk of several types of cancers, lower risk of cardiovascular disease, including high blood pressure and high cholesterol, and lower risk of postpartum depression. The AAP also recommends other ways to reduce the risk of SIDS. And among these, it includes placing the baby on their back to sleep. That's super important. Using a firm, non-inclined sleep surface. Room sharing without bed sharing. Avoiding soft bedding and overheating. Talk to your pediatrician if you have questions about any of these recommendations.